Hello everyone, my name is Erin Ball. Today I'm going to reveal the truth about Lymphangioleiomyomatosis or LAM, a truth that has been hidden for far too long. LAM is officially labelled as a rare genetic lung disease caused by mutations in the TSC1 or TSC2 genes, but this explanation is wrong. LAM is not a genetic disease. It's a parasitic disease deliberately misclassified. Substantial evidence shows that infections with parasites like Wuchereria bancrofti, Brugia malayi, Toxoplasma gondii, and various helminths directly cause the hallmark features of LAM. They block lymphatic vessels, causing chyle pleural effusions, in plain term chyle leaks, into the lung cavity. They damage lung tissue, leading to cyst formation and pneumothorax, which is the collapse of the lung. They trigger smooth muscle cell proliferation, thickening and scarring of tissues. And they can cause pseudotumors that mimic angiomyolipomas. They hijack immune pathways, just like what we see in LAM. The truth is simple. Parasites recreate every key feature of LAM, and I know this personally. I was hospitalized for 3 months with a massive chyle leak that lasted 6 months, and despite my textbook symptoms of lymphatic filariasis, no one tested my chyle fluid for parasites. The pathology form simply said, query chyle. We knew it was already chyle. In any third world country where these parasites are common, a filarial test would have been immediate. But in Western medicine, the possibility of parasites is completely ignored. Why? Acknowledging parasites would threaten billions of dollars in pharmaceutical profits. mTOR inhibitors like sirolimus, also called Rapamune, are the current treatment for LAM. These drugs are incredibly expensive, and patients are told they must take them for life just to manage their symptoms. If parasites were recognized as the true cause of LAM, patients could actually be cured, often with a short course of cheap antiparasitic drugs like albendazole, ivermectin, diethicarbazine. No more lifelong dependency, no more billion-dollar profits for pharmaceutical companies. This is why the narrative around genetic mutations is pushed so hard. This is why no LAM Foundation funds research into parasitic causes. And this is why patients are kept trapped, sick and dependent and misinformed. Every major symptom of LAM, like from chyle leaks to collapsed lungs, one-sided swellings, immune dysfunction, it can be fully explained by parasitic infection. It's not a theory anymore. The evidence is overwhelming, and the suppression of this information is deliberate. It's time to demand real testing. See a functional doctor. Get blood smears, chyle microscopy, antigen panels, and PCR tests for parasites. It's time to demand real treatment with antiparasitic medication instead of lifelong drug dependence. The cure is within reach, and the truth has been hidden long enough. We must fight to expose it and finally bring real healing to LAM patients worldwide. Thank you. This video is for entertainment purposes only. I am not a doctor.